स्वागत करती हूँ बेस्ट सोर्स न्यूट्रिशन के लाइव सेशन में। एंड जैसे हम हमारे लाउड वंस का ख्याल रखते हैं, हम हमारे स्पाउस का ख्याल रखते हैं, क्या हम हमारे हार्ट का, क्या हम हमारे सेहत का भी वैसे ही ख्याल रखते हैं? ही हमें न्यूज़ आई थी कि सुष्मिता सेन, शी गॉट एन हार्ट अटैक, शी वॉज द मिस यूनिवर्स। सो हार्ट जो एक्टिव लोग हैं, जो फिजिकली एक्टिव है, जो फिजिकली परफेक्ट है, इवन दोज पीपल आर गेटिंग हार्ट अटैक, इवन स्पोर्ट्समैन। तो ये जो हार्ट अटैक, हम ऐसा क्या कर रहे हैं हमारे डाइट में, और हम ऐसी क्या गलती कर रहे हैं कि हार्ट रिलेटेड केसेस है वो काफ़ी ज़्यादा बढ़ रहे हैं दिन ब दिन, साल ब साल इंडिया में। सो इसी टॉपिक पे डिस्कस करने के लिए वी हैव अ डाइटिशियन, हर नेम इज डाइटिशियन विमी उपल मैम। डाइटिशियन विमी मैम जो है, शी हैज एन एक्सपीरियंस ऑफ ओवर 28 years in the field of nutrition.
Judy, so thank you so much for inviting me today, for this session, and it's a pleasure to be with you all today.
So firstly, you're looking lovely and it's a pleasure for us to have you. तो मैम, जैसे कि पैंडेमिक के बाद हमारे जो हार्ट हेल्थ की अवेयरनेस है वो काफी ज्यादा बढ़ गई है, तो ये काफी अच्छा चीज हो गया है। आफ्टर पैंडेमिक हम हमारे हार्ट हेल्थ, हमारी सेहत की काफी ज्यादा वी आर टेकिंग केयर ऑफ इट। बट एक फीमेल के हार्ट हेल्थ की और एक मेल के हार्ट हेल्थ का ख्याल रखना, ये कैसा डिफरेंट है मैम?
Julie, you've asked a very pertinent question at this juncture, because a lot of women would be joining us today, for this session. And the most important thing to understand is, the female body is different from a male body. And many people, are not aware that this gender difference is there. You may feel diet makes a difference, activity makes a difference in heart health. Definitely it does. But, surprisingly, being a woman also, it is different because, women incidentally have a hormone called as estrogen. We all have the secretion. And till this estrogen is getting secreted in a proper manner, you'll find, this dilates your blood vessels. So there is proper blood flow, proper, blood volume. And, we do not get these kind of problems like, heart attack or angina, or, these kind of atherosclerosis, high blood pressure, these kind of problems don't happen as long as the estrogen secretion is okay. But the moment the secretion dips, as the woman age, you'll find, the menopausal woman, the estrogen secretion decreases. So as they reach that menopause age, you'll find, this problem occurring, the vessels start getting constricted, and we have, many people falling ill with cardiac problems. So as compared to males, I would say, as long as your secretion is okay, the things don't happen. But, nowadays with this lifestyle, poor lifestyle habits that young girls have, and we often find a problem occurring, like PCOS, or, we have problems like gestational diabetes, happening in pregnant women. We have problems like, endometriosis or preeclampsia and all, which predisposes a woman to, cardiac problems at a very young age, because there's hormonal imbalance and, the secretion of estrogen dips. So, the way we go about is, there are some dietary interventions I would like to, introduce at this point. The first thing to do is, see that your BMI is normal. As long as the BMI is normal, you'll find the hormonal secretion to be okay. And that is the first thing to do. And if you're overweight, reduce weight, get to a normal BMI. Secondly, I would say reduce salt intake. That is very, very important, if your hormonal imbalance is there, cardiac problems, high BP is there, that helps. Thirdly, I would say, we can also introduce omega-3 fatty acids. Omega-3 fatty acids improve our cardiac health. And it helps to, increase the blood flow, and, the good cholesterol, which we call the HDL cholesterol, increases. So the sources of, omega-3 fatty acids are, seeds, nuts, chia seeds, flax seeds, linseed seeds. Then, walnuts, Brazil nuts are very good sources, introducing good oil. Sometimes, adding a supplement there also helps, a supplement like fish oil, because fatty fish are a great contributor of omega-3s. So introducing a fish oil at this juncture also helps, if you're having some cardiac related problem. And of course, Best Source Nutrition has a very nice fish oil, which of course we claim it is free of those side effects we have sometimes, which is there in fish oil, that smell of fishy
Correct, ma'am.
smell or odor comes. So no burping, no fishy odor, nothing, and there it adds lot of omega-3s, which is very important for cardiac health of not only a woman but also a male member. Then there is another thing many people do not know about is phytoestrogens. These are compounds in plants which keeps the plants healthy. But when we consume these phytoestrogens, especially we women, this upscales the estrogen levels in our body. So, the question comes, what are these phytoestrogen containing foods? So we have these soya bean products, which are the highest in this, and soy, milk, tempeh, which we get, fermented soya bean, soy nuggets, soy flour, and various ways. Then cruciferous vegetables, garlic, you'll be surprised, is a very good source of this phytoestrogen. Then, Brussels sprouts, then leafy vegetables like spinach are good, are having good amount of phytoestrogens, alfalfa sprouts, normal sprouts, There is another supplement which comes here, a herbal tea, which Best Source Nutrition has, which is called red clover tea. I don't know whether you guys have heard about this red clover tea, but it has good amount of phytoestrogens. So if the problem of hormonal imbalance is there, or if you're reaching menopause, where your estrogen levels are dipping, red clover tea is a good induction in the diet. So maybe this herbal remedy can also be done along with fish oil to get into proper health or proper cardiac frame. So this is what I wanted to share.
Yeah, ma'am. Like you rightly said कि हमारी जो diet है उसमें भी काफी ज्यादा faults है. There's an increase in smoking, drinking. ये जो सारी चीजें हैं उससे भी heart health के लिए it's causing some issue in the heart health. So ये इसका ख्याल भी रखना काफी ज्यादा important है कि you quit smoking, you don't drink alcohol. So it's very important points that I wanted to discuss. And also, like you said about our Best Source Nutrition's omega-3 fish oil. So omega-3 fish oil जो है Best Source Nutrition does not have any kind of fishy smell. It in one dosage you get 720 mg of EPA and DHA, which is the best. एंड ऑल्सो हमने मेक श्योर किया है कि जो हमारी कैप्सूल की साइज है वो भी छोटी है, सो इट्स इजी टू गल्प इन. मोस्टली दिस omega-3 capsules is a very big huge capsules which are difficult sometimes for everyone to take. So we make sure that it's a premium and the best quality fish oil which we have. So by taking this, just including this omega-3 fish oil, it can be best for your heart health. So ma'am, जैसे कि कोलेस्ट्रॉल लेवल भी सबका बढ़ चुका है. इवन मेल हो चाहे वो फीमेल हो, पहले ऐसा मेल्स में देखा जाता था, बट ओवरऑल टाइम इवन फीमेल्स आर हैविंग हाई कोलेस्ट्रॉल लेवल. बट अगर हमें नेचुरली डाइट के थ्रू हमारा कोलेस्ट्रॉल लेवल मेंटेन करना है तो हम इसे कैसे थ्रू आवर डाइट हम इसे कैसे मेंटेन कर पाए? क्या ऐसा कोई तरीका है जिससे जल्दी हमारा कोलेस्ट्रॉल लेवल एकदम राइट अमाउंट में आ जाए?
Very nice question you put, Judy. Being a dietitian, I would say, diet plays a very important role, in regulating your parameters, especially things like cholesterol or the bad cholesterol, which we call the LDL or the, the VLDL or the total cholesterol. So here again, I would say there are some dietary interventions we can do. Firstly, the intake of saturated fats. Fats also people are not aware of many kinds. When we talk about fats, they just think, it's a common kind of fat that we are eating. But, fats are also broken up into many kinds of fats. Like we have saturated fats, polyunsaturated fats. So, the intake of saturated fats should go down. And the sources of these saturated fats in our diet, the prime source, which sometimes people forego, I have had clients coming to me, even at the age of 71 or 65, they tell me, we are having full fat milk. At that age, if you're having full fat milk, it is full of saturated fats, so that is one big dietary source. Then, your full fat milk products like the curd or the paneer you buy, people think if they are buying a probiotic curd, it's a very good option. But incidentally, that probiotic curd, which they are buying from outside, is very high in saturated fats. So we need to, make curd at home, paneer at home, not use processed cheese, butter, cream. These are the sources of saturated fats. Then, of course, comes the trans fat. Although the Food and Drug Administration, has given a regulation not to use trans fat in products, but still we find, on food labels, this thing written as, hydrogenated vegetable oil, which is actually trans fat. And mostly you will find these in the bakery products or cookies, which we so fondly eat, with our tea or coffee and all. That is the first thing we do in the morning, in fact. So, eliminating trans fat becomes very important from our diet. Then, increasing the soluble fiber intake. Incidentally, people are not aware that fiber is also of two kinds. There's, soluble, insoluble fiber. So soluble fiber takes care of your bad cholesterol. It decreases the absorption of your bad cholesterol. So soluble fiber, if we need to add to our diet, then again, there are certain foods which we can do like, oatmeal or apple, pear, beans, lentils, sprouts, introducing a lot of whole fruits, whole grains in our diet. Even a supplement like isabgol sometimes help as a source of, soluble fiber in the diet. Then, of course, like Julie said, quit smoking, quit, alcohol, because alcohol initially, dilates the blood vessels. But with long-term use or very heavily drinking, when you do these kind of things, it restricts the blood vessels or constricts it. Even tobacco has a chemical, incidentally, nowadays you find women also resorting to smoking. That also has a chemical which is, constricting our arteries. It increases the blood pressure and reduces the HDL cholesterol, which many people do not know, which is a good cholesterol. So when you smoke, every time you smoke, your HDL cholesterol goes down. So, these are the dietary interventions. But here again, I would say some dietary supplements come which help us. First, of course, is the fish oil, which we spoke about earlier, introducing a fish oil supplement helps in increasing the cholesterol, because sometimes diet may take a little time. And nowadays, people do not have patience. You find clients telling me, ma'am, 1 month mein karwa dijiye hamare parameters theek. Now, how do we do it? 1 or 2 months, if we are given, a deadline, then we have to make use of supplements, so therein comes the fish oil and a very good supplement, which Pesos has, that is beta-citosterol. Incidentally, that is a plant sterol, and many people again are not aware of what plant sterols are. It is something which plants have, but which, is like a clone, I would say, or it mimics the cholesterol in our blood. So, it is one way we can reduce our bad cholesterol, especially the LDL cholesterol can be targeted by using these plant sterols. The moment you have high LDL, what does the doctor do? The physician does. The first thing he does is introduce a statin in your diet. And a lot of side effects are there. People are not aware, when you take statins long term, aap dekhoge isse mind fog, gut symptoms aayenge like nausea, your hunger may go away, there are a lot of bad gut symptoms, which come up, digestive issues come up when you're on statins long term. And what do statins do? They stop the production of, further cholesterol by the liver. But these plant sterols, incidentally, which we are talking about, beta-citosterol, they do not have such side effects. So that is the major plus point. So this is something, which we can use in a conjunction with a statin, or, if the LDL is not very high, we can even shut down the statins and start with a plant sterol. And this reduces the absorption of, reabsorption of cholesterol, because like I said, it mimics the, the cholesterol in the blood. So, the body feels already there's a lot of cholesterol in the blood. So, it does not pick up more cholesterol. It stops the further absorption in the intestine or the gut, So that way it works. So it's a very, very effective supplement, and it can be done in conjunction with the dietary regime, which I spoke about, and a good diet plan. So, that is how we can reduce, Julie, the bad cholesterol.
Yeah, ma'am. You rightly pointed about plant sterols and how effective, as a functional food. In abroad, they use this in making breads and other things. So, just incorporating this as a functional food इन आर डाइट कि कैसे ये हेल्प कर सकता है हमारे कोलेस्ट्रॉल लेवल्स को कम करने के लिए, मेंटेन करने के लिए. मैम, यू हैव यूज्ड प्लांट स्टेरॉल और बीटा साइटोस्टेरॉल बाय बेसोस न्यूट्रिशन. Would you like to share any of your case study, any of your client who has, this supplement has been helpful for them in maintaining their cholesterol level?
Definitely, Julie. In fact, I shared the blood reports also once with you. In case you have them, you can, show to the people who have joined us today. And, in fact, one client came to me, she owns a pharmacy, so you can imagine putting such a person, off statin is like, really working hard, and convincing. But I implored to her, okay, you should stop the use of statin. And she was on statin for the past 10 years. And she says, my cholesterol is not getting controlled, ma'am. So when she joined me, she was a very sincere client. And she, of course, followed the diet also very well. But I convinced her to start with this plant sterol. And after a month, in fact, I asked her to stop having this statin and just do beta sitosterol. And this process continued for about 2.5 months. And after 2.5 months, like I said, sometimes clients lose patience, and she got a test done. And, such a miracle it was that the cholesterol levels were absolutely normal. She says, ma'am, since so many years, with statins also, my cholesterol has been, on the higher side. So this is the first time my cholesterol, my HbA1c is normal, so it was really a miracle. And this is what I wanted to share. And consequently, of course, I have been doing beta sitosterol with many of my clients, and they're very happy with the results they are getting, in their blood tests.
Yeah, so much, ma'am, for sharing your experience. And we got a one question I'd like to answer that, like example of plant sterols. Definitely, जो हमारे खाने में काफी ज्यादा plant sterol की मात्रा होती है. Even rice bran has plant sterol, even soy has plant sterol. But जो हमारे diet में या natural sources में जो plant sterol होती है ना, वो काफी कम मात्रा में होती है. तो अगर हमें cholesterol lowering effect चाहिए, तो हमें वो supplement के थ्रू ही मिल सकता है, because हमें वो 1.5 to 2 grams per day हमें उसे लेना है to help it show the cholesterol lowering effect. So from the natural sources, definitely we can't measure कि हमें rice bran से कितना आ रहा है तो that it's a it's for ease कि हम इसे supplement के through ले just for a shorter duration of 90 days is what we recommend of Besos Nutrition's plant sterol beta cytosterol कि आप इसे 90 days duration के लिए ले and उसके बाद अब आपके lipid profile करिए and you will definitely see a change. Your this cholesterol level will definitely managed by taking it for a shorter duration just for 3 months. Yeah, so being said that, ma'am, like we like we know कि oils जो है हमारे diet में, Indian diet में, Indian cooking में काफी ज्यादा vastly use होती है, खास करके saturated fats, ghee, oil, we use it in our cooking. So अगर हमारी diet में saturated fat की मात्रा काफी ज्यादा है, तो हमारा जो good fat to bad fat ratio है, LDL to HDL ratio है, वो maintain करना difficult हो जाता है. So ma'am, like what dietary intervention, क्या हम इसे कैसे हमारे LDL to HDL ratio हम इसे कैसे maintain करें, ma'am?
See, this is a very good question. And, sometimes people are also not aware of what this, LDL, HDL ratio is. So a little bit, I'd like to explain about this ratio also and what is a normal ratio, and then talk about the interventions which we can do. So, this ratio very easily you can calculate also. If you have your total cholesterol there, just suppose it is 200 and your HDL cholesterol levels are about 50, so you divide your total cholesterol by your HDL cholesterol level. So when you do that, you get a, the ratio, like in this case, if I say if it is 250, it would be 4:1, so normally physicians or we dietitians, prefer a ratio of less than 3.5 or 3.5. That is a good ratio. to have to, the HDL cholesterol to the LDL cholesterol. That is the kind of ratio we look forward to. So this was, how you calculate that ratio. But then, how to improve that ratio is the big question again. So the most important thing that we need to do here is to increase our HDL cholesterol, our good cholesterol. When we increase the HDL cholesterol, it pulls down the levels of the LDL cholesterol. That is how we do it. So of course, one way is, again, like I said, a good diet, which I spoke about earlier, that reduces the LDL and increases the HDL. And the most important thing here, I would say, is introducing omega-3 fatty acids. When you introduce omega-3 fatty acids, your HDL cholesterol jumps up. So this is the way we do it. Okay, introduce, some seeds, some nuts in the diet, some more sources like good oils, in the diet. And of course, sometimes people also come up with this question, okay, can we eat ghee if we have high cholesterol? That is a very commonly asked question. Now, ghee, incidentally, is a source of, saturated fats, and it has small amount of monounsaturated fatty acids also. So I would not say, eat lot of ghee, because if you have high cholesterol, you will find, your cholesterol levels, bad cholesterol levels going up if you have a lot of ghee, or just depend on ghee. So here the role of a good oil comes, maybe a olive oil injunction, or we don't get avocado oil or flaxseed oil so much in India, but avocado oil, flaxseed oil, even eating normal avocados, introducing a lot of seeds and nuts, these are the sources of omega-3s in the diet, which we can do. And here again, we can talk about, having a supplement in the diet, like fish oil, to increase the HDL cholesterol levels, So the more the HDL goes up, the better would be the ratio, and the higher the ratio, the more the chances of a cardiac problem. So we need to lessen this ratio. It should be lesser. The lesser the ratio, the better it is. So this is how we do it.
Correct, ma'am. Like you rightly said about oils, but I would also like to add in कि हमें cold press oil, if we are using cold press oil, that is better. Cold press को हिंदी में कच्ची घानी भी बोलते हैं. तो कच्ची घानी का जो तेल होता है, जिसे प्रेस करके हम ऑयल निकालते हैं, वो टेक्निक से जब भी ऑयल निकलता है, तो उसमें कोई सॉल्वेंट, कोई केमिकल यूज नहीं होता इन द प्रोसेस ऑफ एक्सट्रैक्टिंग द ऑयल. तो वो ऑयल काफी प्योर होगा और काफी हार्ट के लिए healthy hoga. So you can do this, you can switch to a cold press oil. That will also be helpful for managing your cholesterol levels. So ma'am, like hypertension or high blood pressure, हमें लगता था कि ये age related issue है, कि after a certain age we get hypertension, but अभी ऐसा नहीं है. 30s 40s people are getting hypertension. So high blood pressure is very common. तो high blood pressure के लिए ऐसा हम क्या चीज कर सकते हैं through our diet to maintain our normal blood pressure range, ma'am?
Here again, I would say blood pressure nowadays is not an age-related issue. I find clients, coming to me at a very young age with, issues like high BP, even high, LDL cholesterol, and you'll be shocked. My youngest clients are 13-year-old. I have a client in Canada, I have a client in India who are just 13-year-old girls, as young as that. So you can imagine if at that age they are having high LDL cholesterol. So there are greater chances of them developing hypertension. Then, of course, the stress that is there, the sedentary lifestyle, which nowadays children are following, So all these add up, to increasing our blood pressure. So, the intervention that we do is, first, of course, like we say, the DASH diet, works the best, the dietary approaches to stop hypertension. And in that, again, increasing the fiber intake works very well, because that dilates our blood vessels, So it really, really helps if we introduce a thing like, soluble fiber in our diet, increase the fiber in our diet by adding whole grains and all, Then adding sometimes, things like diuretics also helps, because the kidney function improves, So in diuretics, sometimes the doctors add medicines, sometimes we do certain herbal teas also, which act as diuretics, to reduce the, blood pressure and increase the urine flow, And of course, the most important dietary intervention which we say is to reduce the salt intake. When you reduce your sodium intake and upscale your potassium intake, these are the two important minerals which work well, in a blood pressure diet or a hypertension diet, So using good salts, like the naturally occurring pink Himalayan salt, rock salt in the diet, or certain companies also have come up with sodium reduced salts, like we have Tata Light and all, where the iodine is there but the sodium is less in the diet. These kind of interventions work, and sometimes even introducing a herbal tea here helps a lot. Like we have a very nice herbal tea, hibiscus tea, which has been introduced by Bessos. And hibiscus incidentally is a flower which is used in dissection, in science classes and senior science classes. So I think most of you all are familiar with what a hibiscus flower is. It's a red colored flower. And a hibiscus flower incidentally has a lot of polyphenols. It has a thing called as procyanidins, which reduces your blood pressure. So, it is very, very effective in reducing your systolic blood pressure. Therein it works, and helps to reduce your blood pressure when you introduce in the diet. And it is in the form of dried flowers, this herbal tea. So you don't have to go around looking for that hibiscus flower, or grow it in your flower pot. If you are fond of gardening, of course you can do that. But here again, the hibiscus tea works, as a good supplement which we can do if the blood pressure levels are shooting up. In fact, I have had clients, coming back to me and saying, "Ma'am, I had an uncontrolled blood pressure, and jab se maine hibiscus tea shuru kiya, my blood pressure is really, really improving." I have had clients thanking me, in fact, कि मेरा ब्लड प्रेशर प्रॉब्लम बिल्कुल क्योर हो गया, एंड अभी मुझे कोई प्रॉब्लम नहीं आई मैम, आफ्टर फॉलोइंग दिस डाइट एंड हैविंग अ हाइबिस्कस टी, therein. Then another supplement which many people are not aware, is grapeseed extract. And grapeseed extract is dried grape seeds, and this is also thing which has a lot of procyanidins, so that is a component which helps in decreasing the blood pressure. So grapeseed extract is also a very effective supplement, which can be used, and that works in another way, dilates the blood vessels, so when that happens, the blood is able to flow easily, so grapeseed extract works as an antioxidant also. It works, to reduce the blood pressure very effectively. So these are the two things also which I use, in conjunction with diet. And most important thing which we tell the clients is to lose weight. Even a small reduction of, 5 to 10% of the weight reduction would, dilate your blood vessels. It would increase the blood flow from the heart, and it helps. So reduce weight if you're overweight. That also helps. And of course, these herbal teas help a lot. And I have been using it with my clients very frequently. And it has really worked like a miracle,
So we discuss about everything, but one main topic which we wanted to discuss is कि जो youngsters है आजकल के, youngsters, they are into sports, they are into dance, they are into all sort of physical activities. So youngsters के लिए what kind of diet tips would you like to give to help their heart health? Because we have seen कि there is an increase in the heart risk for youngster as well, which is quite concerned, like you mentioned about having a younger patients who are having heart related issues. So what are some tips, top five tips would you like to give for young people?
The first step I would request all young people, out there, who have joined this session today, is to get active. Nowadays you would find youngsters, just sitting in front of the, the mobile or the computers or the laptops, and they are just sitting and doing all the activities, everything is online. And even things like, shopping and all, they do not walk out of the home and, shop. They order it on online portals. It's not that you should not use online portals, but the thing is, improve your activity levels. That is the first thing, Second, I would say, is of course, improve your diet. 70% of what you eat is what you are, so improve your diet, improve your lifestyle, what you're putting in your mouth is very, very important, so eat whole grains, less of, sugars, sugary containing beverages. Nowadays, a lot of energy drinks are there, which, my clients come up and ask me, can we take that energy drink while we're exercising? So I tell them it's full of sugar, you should refrain from doing that. So, these energy drinks that are there, or, the carbonated beverages, I have a client, of course, I would not take any names, but you would be shocked. His triglyceride levels are 800. So when I asked him, what kind of diet he takes, he says, diet is okay, but I take a Coke every day. So you can imagine, with a triglyceride level of 800, what would happen to that client, as he ages. So it is very, very important, to be mindful of what you are eating. It should not be high in sugars. It should not be high in trans fat. Increase the soluble fiber intake. Then, thirdly, quit smoking. If you are an avid smoker, like I said, even tobacco has a chemical, nowadays people are very fond of smoking, of drinking, of smoking. So this is another thing I would say, to all the youngsters out there. Quit smoking, quit alcohol, that is very, very important. Then fourth is, of course, do not take so much stress in life, because jitna aap stress lenge, aap dekhenge, the situation doesn't change. It is going to remain the same. So it is better to have a good mindset, have a positive approach to anything. And for this, you can do meditation, and, you can focus on positive thinking, so that helps, because life is very stressful nowadays. So much of competition is there. And of course, going into something like, like I said, there are many herbal teas, many supplements, source, which of course offline we can discuss also sometime, which can be introduced in general in the diet, like we have a multivitamin for women, which takes care of all the deficiencies and all. So that is very, very helpful for getting a good night's sleep also, because it has ashwagandha in it, So taking a multivitamin, if you are not very good with the balanced nutrition out there, or, taking a good, herbal tea, a detox tea is there, in Vessos, which you can, try out and, do these herbal teas, or, introduce maybe a fish oil in your diet to maintain your cholesterol levels, an omega-3 supplement can be done, lifelong. So these are the things, I would say to youngsters, I don't know whether I've done 5 of them, but I think I've told enough. Those are the things I would like you all to do.
Yeah, ma'am. You rightly said supplements with diet, with, taking care of your overall health, reducing the stress, all those things are a key for a healthy heart. Ma'am, there's a one question which is posted. Let me just check. Yeah. Do the doctors agree for reducing statins?
See, like I said, the moment you walk into a clinic, the first thing the doctor would say is start a statin. Even a level as high as just 4 points, 100 se 104 nahi ho gaya ke physician kahenge aap statin start kar lo, because that is the safe way out for them. Because then they know, the client is not going to have cardiac problems. But like I said, going long term on a statin, I have had clients coming to me and telling me for the past 10 years, 15 years, ma'am, I have been having these statins, and then they come up with this thing, I have so many digestive issues, ma'am, I feel nauseous all the time, bloated, and, and these gut issues arise because they have been on statin for such a long time, so it is good to improve your diet. First thing, reduce weight, if you have this kind of problem. And of course, do some good dietary supplements, like, a plant sterol, maybe, in place of a statin. So that really helps, so I would advise not go for a statin immediately, but work on the measures which I've discussed.
Yeah. So, and also one question which we got is triglyceride or high LDL level are which is more injurious, triglyceride level or LDL level?
See, we cannot say which is more injurious. both are injurious, you know. So it is important कि आप LDL भी reduce करो, triglyceride भी reduce करो. But here I would like to add, if you have a triglyceride level as high as 800, there I would not say, you know, you stop the statin, because that would be little injurious to the heart. But up in conjunction with a plant sterol and a good diet, you know, you can do a low dose of statin and maybe wean it off after some time, you know. If you feel that my diet is working, my plant sterol is working there, my fish oil supplement is working there, you know, and I have increased my activity levels. So at that point of time, you can take a call, visit your doctor, and, you know, in fact, shut down the statin, you know. So that is the way we can do it.
Yeah, one more question which we have got is, ma'am, do we need to reduce calcium score levels with diet if we want to stop statins?
No, absolutely not. In fact, अगर आपको ऐसा लगता है कि मेरी calcium levels low जा रही हैं, a blood test would tell you that, you know. कि अगर, like I said, you know, it has a lot of side effects, these statins. So अगर आपको ऐसा लगता है कि मेरी calcium levels dip कर रही हैं, then that point of time, of course, we need to start with some calcium, you know, containing foods. जैसे आप milk products start कर सकती हैं, which are very good in calcium. You can start with egg in your diet. If you are eating non-veg options, आप milk as such पी सकते हैं, you know, for introducing the calcium. Then of course the green leafy vegetables is a good source of calcium. Your broccoli is a good source of calcium. Your seeds are a good source of calcium. Chia seeds especially works very well here, you know, it is very high in calcium. So, you know, making certain dietary changes along with stopping those statins would help, but that only a blood test can determine, you know, whether you're dipping in calcium. Only if you're going low in calcium, that moment of time we need to start the calcium.
Yeah. Yes, ma'am. So, one more. Yes, ma'am. I would like to ask you, like, any few words which you would like to say about our best source nutrition.
I would in fact like to thank Best Source Nutrition, because, you know, when I was very young, I was also of the mindset, you know, that supplements are not needed. And in fact, I just used to try doing it through diet. But, you know, in long term, I realized, you know, that the diet would take a little longer time. And today people do not have patience. You know, often you'll find people often, like I said, people come to me and tell me, ma'am, in 1 month, make my, you know, LDL cholesterol okay, or can I reduce my triglyceride levels in 2 months, you know. So when they are lacking patience, you know, here supplements help, you know, because they quicken the process of the diet, you know. So if they are used in conjunction with a good lifestyle, a good diet, you know, so they really, really help. And I had once, you know, taken, in fact, I would say a online thing also with a nutritionist. I would not take any names, but he gave a very good example, you know, for a curcumin supplement. He said कि if we, you know, give haldi as such, you know, तो आप देखोगे आप 1 चम्मच 2 चम्मच खा सकते हैं, but when we do a curcumin supplement, almost a katori full of haldi is coming, you know, that kind of injunction. So do we eat a katori full of turmeric? We don't, you know, during the day. But if we do a curcumin supplement, आप देखोगे वो body में inflammation इतनी reduce करता है, you know, and number of benefits of that supplement. So supplementation helps, you know. So here in Best Source Nutrition comes, you know. So I found that they have such wonderful supplements, you know, and I love using their supplements in the diet. And in fact, my clients also know, you know, how their parameters have, you know, miraculously changed. After doing the diet, of course, and after, you know, doing these supplements. So, you know, at an Indian level, you know, at an affordable price, I would say, you know, these supplements really work well with the diet plan. So thank you, Vesos, for giving us these supplements. And some supplements people do not even know what they are. Like, you know, I have overseas clients, I tell them about dandelion or milk thistle and all, you know, so they are not even aware of what these supplements are. So, you know, it is so wonderful that Besos has come up with these herbs, you know, and right from the Himalayas, they are picking it up and, you know, packaging it and sending it at home to you. So kudos to Best Source Nutrition doing that.
Ma'am, this is what is our main motive, to bring the best herbs from the mother nature. And it's not just about supplements, it's about these plants. You know, they have such various benefits which just by adding in a diet, they can do wonderful things, and you don't need to take medications. You need to take this wonderful plants to, you know, help maintain your health. Ma'am, one more question which we have got is why Sushmita Sen had a heart attack at such a, you know, young age. At I think 47 she was, and so incident that, you know, or we must have heard in the news that suddenly she had a heart attack, and it's really a concern to every Indian, like how should we, you know, take care of our heart
This
healthy.
is a question which, of course, Sushmita Sen would be able to reply, you know, what kind of lifestyle she was having, you know, what kind of foods she was incorporating. I'm sure being Miss India, you know, she was very, very well educated, well aware, you know, what kind of diet. But sometimes, in spite of knowing what is right for us, we tend to, you know, go for things which are not right, like, you know, late night sleeping, you know, not getting up in the morning. You know, morning mein aap dekhoge, the oxygen levels are really high, you know, so taking a walk in the morning air works well for the body, you know. So sometimes our lifestyle is not good, you know, and sometimes the kind of foods we are having, sometimes the stress, you know, levels are very high, you know, for people like Sushmita Sen. You know, there is so much of competition out there, you know, and the life is so much full of anxiety, stress, and also, you know, maybe all those factors combined together, you know, that, like I said, you know, my youngest client of high cholesterol is 13 years, and I have two girls that age, you know, doing their diet currently with me, you know. So the mothers are very concerned why my child is having such a problem, you know. So but it is happening. So if a 13-year-old child can have high cholesterol, you can imagine by the time that child is 25 years or 30 years, he may even have a cardiac or a heart related issue, you know, because this is mainly responsible for the plaque formation, for clogging those arteries, you know, which give us the blood flow. So maybe all those factors worked in Sushmita Sen's case.
Yeah, ma'am, likely said about the dietary changes that which we need to make, and the tips which you have shared with us, the dietary tips, the, you know, supplements which we need to incorporate in our diet. So I would like to thank you for joining us in the live and spending so much time in explaining us every detail. And so absolute pleasure for us to have you and, you know, to speak on this topic. Thank you so much, ma'am. And yeah, and the audience who have joined us, thank you so much everyone for joining. And if you want to know more about Best Source Nutrition Supplement, you can visit our website bestsourcenutrition.com. You can get all the information there. Yes, ma'am. Would you like to, you know, say anything to our audience who have joined us?
Well, I'm thankful to all of them who have joined this session, and I'm sure, you know, it has helped them today. You know, it was informative, or I was able to settle their queries. But of course, you know, you'll not be able to do it in a live session so much. So you can always
Yeah.
message me offline on my
Yes, ma'am. We
Instagram,
have
and
getting a lot of
definitely I'll
replies.
respond.
Yeah,
So,
we are getting
you know,
replies, and they really love we are getting many replies from everyone. Thank you so much. And yeah, it was a great session. Thank you so much, Vimi, ma'am. Yeah.